tell us the kind of the golden age, and then kind of tell us where we should go from here on what is that magic number. It keeps changing. I listen to the journal, and when I first started, that magic number was 42. And then they were like saying the fertility rate was, we're wrong, we made a mistake. It was now like 40. Then I look again, now it's 35.
Yes.
So, give us the latest NIH type of importance. Where should we focus and what should we do?
The main factor is that we're born with all of our eggs, and a lot of women don't appreciate that fact. We actually have the most eggs in our ovaries before we're born, about halfway through a pregnancy.
How many eggs do we have?
We have about 6 or 7 million
eggs
in our ovaries before we're born. By the time we're born, it's down to 1 million already.
We're losing eggs.
We're losing eggs, and as we go through puberty and reproductive years, we just gradually lose eggs from our ovaries that we do not get back.
But we still have enough eggs to get pregnant, obviously.
Yes, we definitely
Okay.
do. We don't need millions of eggs to get pregnant, but just that pool of good quality eggs is getting smaller as we get older. And we see that process where we lose eggs become accelerated somewhere around 37 years old, where we lose eggs more rapidly until we get to menopause, which is around 51 years old. And that's when our egg supply is depleted. In addition to having a smaller pool of eggs available, the quality of the eggs that we still have is changing as we get older. And that's because our eggs are aging just like we are. So the quality and the number of eggs tend to change in our 30s. So really, we recommend that women who are over the age of 35, really after 6 months of trying, if they're not getting pregnant, that they should come in and be evaluated. And we can do testing to look at other infertility factors, but also to look at what we call ovarian reserve, which gives us an idea of the number and the quality of eggs that are available and the likelihood of response to treatments if we do that, and the chance of getting pregnant.
So basically what I hear you saying is that women basically need to pay attention to the age in which they're thinking, and that one, because Dr. T's healthy living and tips are basically you need to pay attention to what you eat.
Yes.
Because if I remember correctly, certain dyes affect the genetics of the eggs, like red dye number 3 and all that kind of stuff was basically a bad. So get rid of the red Kool-Aid, start eating healthy, take your vitamins,
yes,
exercise. All these things help your fertility. But also, what I also heard you say is we want women to basically recognize that myth of being 40. You need to start focusing on being in your 30s.
Yes.
And pay attention to your fertility or your fertility at that point in time. And if you basically have a question, you need to check a OBGYN, or you need to come in and see Dr. MK and get an evaluation on that. You need a specialist to evaluate it, and not wait and say, oh, well, I think it's gonna be okay. It's not gonna be okay, because once you have a problem, it's so difficult to correct it.
Yes, and I agree that there is a myth that in our 40s it's okay to start trying and to think about getting pregnant. And unfortunately, we see a lot of older women, and it's being glamorized. We see ladies in Hollywood and on the red carpet with their big bellies, and they make it look like getting pregnant in your 40s is easy. But what we don't realize is that for many of those women, they've undergone fertility treatments in order to get pregnant. And so we do encourage women to just be proactive. You can come in even if you're not ready to get pregnant now, and we can do an assessment just of your ovarian reserve at that time.
And it's going to cost them $1 million for an assessment?
It'll definitely not. It's a regular office visit.
It's a regular office visit for an assessment. And if you're thinking about, say, well, I want to do it in a couple of years, well, basically I can get an assessment now. It'll give me a percentage or an opportunity to think about where I am, and do I really have a couple more years to wait, or do I need to focus right now?
Exactly. And if we do the testing and it shows that the ovarian reserve is already starting to be a little bit lower, then that's support for you to be a little bit more aggressive about pursuing your pregnancy and not waiting until things are really much lower before you get started.
And ladies, it's much easier to fight going forward than fight from the back. So you don't want to fight from the rear. You always want to fight going forward.